Our numbers today are, thankfully, very much business as usual. There are the 2 new cases in managed isolation. One of those is an historical case, and we have no new cases in the community. All the regular information is about to go up on our website, including about the 2 positive cases that are siblings linked to Case I that we did talk about yesterday evening. Yesterday's news of additional cases, I know, was unsettling. Feels like another climb up on our roller coaster ride, but it does not need to be alarming. I'm confident the system is working as it should under Alert Level 1, and there is indeed a lot of work underway. Of course, our very close monitoring, our ongoing follow-up of any of our contacts who are in isolation will continue. So there are now 11 cases associated with this cluster, and all these cases are in the Auckland quarantine facility. We can confirm the genome testing for Case I, which was the first case we announced yesterday, has shown to be the B117 variant and very closely related to the genome sequence for our first cases, Cases A and B, that had an identical, those 2 cases had identical sequences, and this one is very closely related. This is what we expected, and it does provide reassurance that the cases yesterday have not appeared in the community at random. There is not another source of infection here. So both Cases A, the original schoolgirl, and I yesterday are genomically linked. Both are students at Papatoetoe High School, and both were at school on the 10th of February. We haven't established the exact transmission link between the 2, but it is likely to have occurred in a common area such as a bathroom or corridor. We do appreciate there is a lot for people to absorb around these latest cases, and we are continuing to make information available as quickly as possible and as clearly as possible. All the current information about what people need to do within the different categories of contacts is being published and regularly updated on the Ministry of Health website on the Locations of Interest page. This is something of a one-stop shop for people who may have been at those locations of interest, and includes clear instructions about what is expected of them. And of course, Healthline also has that information. So moving to the wider outbreak, you might recall that our contact tracing had previously identified a total of 126 close contacts associated with the 2 previous households, which were Cases A to H. All these contacts have now returned negative tests, except for 3 who have not been tested. 2 of these are children, young children who are not required to be tested, and others in their households have returned negative tests. There is 1 contact from the medical clinic we have not yet been able to track down, but will continue to follow up with. That was considered a low-risk exposure event. Of the 1,496 casual plus contacts from Papatoetoe High School, initially from the 10th of February, 1,487 have returned at least 1 negative test, and I can say there were over 600 students and staff tested yesterday, and already 328 tested today back at the college, so getting through those second tests very quickly. Those who have all had a test have returned negative test results, except for 3 close contacts who have not been tested. Sorry, there are 3 positive cases, which are our cases E, I and J. Otherwise, everyone has had 1 negative test. There are 6 students who have not been tested. These are all being actively followed up and contact made, including visits to the household. For yesterday's cases, I, J and K, there have only been 4 close contacts identified outside the household so far. 874 people have phoned Healthline, indicating they were present at one of the locations of interest and at the relevant dates and times. And in this particular instance, as we've talked about, we are being especially cautious and are managing these people, even though they are not close contacts, we are managing them as if they were close contacts. So they will be required to stay at home for the full 14-day period and be tested at day 5 and then day 12, and they will receive daily follow-up from our public health units and others. Our national contact tracing systems are in action. Indeed, our wider public health units around the country are helping out with this follow-up of these people as well. It's a very active process, and if necessary, visits to houses are made to ensure people have the support they need to remain isolated and to access testing. There are plenty of community testing centres available around Auckland as usual. Those closest to the locations of interest are in Botany, Otara and Wiri. I understand there were some queues there this morning, so reminder that there are other sites people can go to, and also many GPs and urgent care clinics can test, and testing is free wherever you have it done. And finally, just perhaps a word on variants. We're actively monitoring the emerging evidence about these new variants from overseas, including around infectiousness, incubation periods and symptom presentation. There are questions around, of course, that have been raised here about why some very close contacts don't seem to be infected, but in this instance we've had what appears to be a very casual interaction that has led to an infection. Of course, this is just seems to be the nature of this virus, and particularly these new variants, so we'll be following that evidence up very closely. And I just want to emphasise too that several of our recent cases with this new variant have had what one might call atypical symptoms, where their main symptom has been muscle aches and feeling tired rather than typical respiratory symptoms. So I do want people to be aware of that. Sometimes people ascribe these symptoms to other things, such as post-exercise muscle discomfort, sore muscles. So if people could just keep that in mind. And in several of these latest cases, the students have not felt particularly unwell or have understandably ascribed their symptoms to something else. Wastewater testing continues around Auckland, and all of that so far is negative, aside from the positive tests we frequently get for the pipe that is draining out the jet park, as we would expect, and that acts as a bit of a baseline comparison. Around alert level changes, I know there will be a lot of interest in that. I've formally sought advice from Dr. Ian Town, the Chief Science Advisor at the Ministry, and Dr. Caroline McElnay, the Director of Public Health, both last night, and we talked again this morning, and we don't see any need in the current situation to advise around raising the alert levels. It's not dissimilar to the Northland situation we had several weeks ago, with a large number of places of interest that we successfully were able to follow up, isolate and test people to get ahead of it.